Welcome back, viewers, to Faith and Discipline podcast. Our guest today is Dr. Inam Khan. He is a consultant endocrinologist. Welcome, Dr. Khan, to Faith and Discipline podcast.
Thank you so much for having me back on your podcast again. It's a pleasure.
What is the function of thyroid gland?
So thyroid gland is one of the most important glands in the body. It is vital for human life. Thyroid gland is located in the front of the neck, the lower part, and it has got two lobes, which we call it. And it produces some very important hormones called thyroid hormones. There are two types of hormones, thyroxine and triiodothyronine, or more commonly called as T3. It also produces another hormone which is called calcitonin, but it's not entirely related to the thyroid hormones we are talking about today. As I mentioned, it is a very important hormone in the body. So its main function is to regulate basal metabolic rate in the body, which simply means that whatever calories we are eating, and the body is utilizing that, and that is regulated by thyroid hormone. And in that way, it actually affects each and every part of the human body, which includes heart, our digestive system, our nervous system, our skin, literally every part of the body. That's why any kind of abnormalities or any problems in the thyroid hormone levels can actually affect the human body in a certain way.
Okay, what is hypothyroidism?
So hypothyroidism is actually failure of the thyroid gland to produce thyroid hormones. We generally can say that this thyroid hormone production is controlled by another gland called pituitary gland, which more commonly we call it as a master gland, because it releases a signal which affects the thyroid gland to make it produce more of the hormones. And when, for some reason, if it fails to produce that hormone, that condition is called hypothyroidism.
Okay. For our viewers, pituitary gland located right behind our eyes in the brain, pea size.
Yes, it's a small gland which is located in front of the brain, but it's the most important gland in the body.
What are the symptoms associated with the hypothyroidism?
So when there's a deficiency of thyroid hormones in the body, everything slows down. So which means that the basal metabolic rate goes down, and it manifests in certain symptoms, such as a person will be feeling very tired, fatigue. They would be feeling sleepy even during the daytime as well. The skin becomes a bit thick, and the hair can also be thick as well. Then they would have slow heart rate. They would have constipation as well. And it can, in females, it can affect the menstrual periods. They can become quite irregular and heavy as well. So these are the general symptoms of hypothyroidism. So basically, it depends on the amount of deficiency.
Okay. Are there any serious complications associated with underactive thyroid?
Yes, definitely. So if the condition is left untreated, then what could happen is that the heart rate can go down, and as a result of that, the blood pressure can be quite low. A person will be feeling quite cold, and the body temperature goes down to dangerously low levels.
Okay.
As a result of that, a person would be stuporous or comatose as well. And if it carries on, then eventually it can lead to death.
Unfortunately. Is there any link between hypothyroidism and it's called hyperlipidemia and angina or MI up to that level?
Yes, definitely. So underactive thyroid will lead to high cholesterol levels in the body because it's closely linked with the lipid metabolism as well. So when the cholesterol levels remain quite high over time, then that would lead to high risk of getting cardiovascular complications, angina, MI.
How serious it can be for pregnant ladies?
Yes, so it's a very important point, because when a fetus is developing, it is actually dependent on mother's thyroid hormones. So if mother already has got hypothyroidism, what we suggest is that we would increase the dose of the thyroxine tablets that they're taking in order for it to meet the demands of the mother and also the fetus as well. So it's extremely important that whenever females get pregnant, we refer them to our antenatal clinics where this condition is better taken care of.
Okay. What are the reasons for this disease or symptom to set in?
So there are different causes for hypothyroidism. The most common one is autoimmune condition called Hashimoto's thyroiditis, in which there are antibodies in the blood which act on the thyroid gland and cause inflammation and destruction of the gland. Apart from that, if somebody had neck surgery, or if they had any radioactive iodine treatment for overactive thyroid, that would lead to hypothyroidism. If they are taking anti-thyroid medications for overactive thyroid, and if they are given in slightly higher doses, that could lead to hypothyroidism. In underdeveloped countries where there is iodine deficiency, that can also lead to hypothyroidism, but it's not very common in the UK.
If the patient comes to you, and how do you diagnose this condition?
So initially, history and physical examination, as I mentioned before, the symptoms. And after that, when we suspect that there could be underactive thyroid, then we do thyroid function tests. Now that includes both of the thyroid hormones and also the TSH, or the thyroid stimulating hormone, which is being produced by the pituitary gland. So in patients with hypothyroidism, the thyroid hormone levels will be low and the TSH levels will be high. So basically, the pituitary gland is trying to stimulate thyroid gland to make it produce more hormones, but it's not working. So these are the common tests that we would be able to diagnose hypothyroidism.
After you have diagnosed the disease and you are confirmed this is hypothyroidism, how do you treat it? What are the options available?
So it's quite a simple mathematics. That body is deficient in a particular hormone. We just replace it with the levothyroxine, which is basically a synthetic form of thyroid hormone. It's very commonly available. It's quite cheap to get as well. So we replace it with that tablet. In some patients, we can give the activated form of the thyroid hormone called T3 or liothyronine. It's not very much commonly used, only in very specific situations.
Okay. Are there any side effects of these medications?
Yes, so whenever we start patients on these medications, we do some periodic blood test to ensure that they're on the right dose. In some situations, if these are taken in excess, then it would lead to a patient having symptoms of overactive thyroid, because there is too much of thyroxine tablets in the blood, and that would lead to complete opposite effects. But generally, per se, the tablets are very well tolerated, and patients do not suffer from any significant side effects.
Okay. What is the role of the iodine in underactive thyroid function?
Yes, so iodine is the most important component of the thyroid hormone. So the thyroid gland requires iodine to be present all the time to make the hormone. In specific situations when there is severe iodine deficiency, then it would lead to underactive thyroid, because there is not enough thyroid hormones in the body. So that's why iodine supplementation is important in underdeveloped countries. There's been a drive in the past 30-40 years that it is included in table salt so that this deficiency is corrected.
Okay. Let's talk about hyperthyroidism. What is overactive thyroid function.
Yes. So the complete opposite of hypothyroidism, the gland produces thyroid hormones in excessive amounts, which leads to certain signs and symptoms which manifest in the body.
Okay. And what are those symptoms?
Yeah. So as a result of the increased basal metabolic rate, a person with hyperthyroidism will be feeling hot all the time. They get palpitations or racing of the heart, sweaty palms. The blood pressure can go high as well. They can have looseness of the bowels. It can manifest as person feeling quite nervous, anxious all the time. And they can lose weight.
Okay.
In some specific situations, which we would explain in a moment, patients can have some eye symptoms as well.
Okay. Do we know the causes of overactive thyroid gland?
Yes. So again, there is another autoimmune condition called Graves' disease, in which the antibodies act on the gland and make it produce excessive amount of thyroid hormones. It's one of the most common causes of it. Apart from that, the thyroid gland can actually get bigger in size, and it's called multinodular goiter, in which different lumps appear in the gland which produce hormone. And there could be just one single lump as well. Apart from that, it could be as a result of any kind of viral infections which cause inflammation of the gland, and there's a transient overproduction of the hormones, which actually self-limiting. So these are the most common ones.
Okay. Can some of the symptoms become worse if not treated?
Yes, of course. So if left untreated, the levels will keep on going very high, and that might lead to arrhythmias, which is the irregular heart rate, and the heart rate can be quite fast. That could actually lead to changes in the blood pressure, and a person being extremely unwell. Their body temperature goes very high. They can become dehydrated. The kidneys can be involved as well.
Okay, and you were mentioning about eye problems and flare-ups.
Yes. So it is associated with Graves' disease. So we call it thyroid eye disease, which is linked with Graves. But when it's treated, it's kind of it's got an independent course. A person may have sore, gritty eyes. They can be watery as well, and they can actually the eyes can be quite prominent.
Okay.
Again, if these are left untreated, then it could lead to double vision and severe disfigurement.
Okay. As we discussed about hypothyroidism's link to pregnancy, is there any link between hyperthyroidism and pregnancy?
Yes. So thyroid hormone levels can be affected in pregnancy in the initial few weeks of that, and females can have some of the symptoms of it initially. It depends on the levels of the hormones and the antibody test, and then it is decided whether we would be able to treat it or not. If the levels are extremely high, then yes, we go ahead, because it can actually lead to severe complications during the pregnancy.
Okay. How did you diagnose hyperthyroidism?
So history and clinical examination to start with. After that, we do blood test. So it's the opposite of hypothyroidism. The thyroid hormone levels will be quite high. In cases we are suspecting Graves' disease, we check antibodies as well. And apart from that, we check their liver function test as well, and their full blood count, to check for any complications they can have as part of the treatment.
Okay. And what are the treatment options available for hyperthyroidism?
So if we think that it's related to the viral infections, as I mentioned, it's kind of self-limiting, so they don't need any treatment. But in other cases, we give them anti-thyroid medications in the form of carbimazole or propylthiouracil, or more commonly called as PTU. So they control the overproduction of thyroid hormones in the body. In patients who have got quite severe symptoms, and before the antithyroid medications have their effect, we give them beta blocker tablets for symptomatic benefit. Most of the patients their condition is quite well controlled on this, but in some severe cases they would require hospital admission, and there are some other options like steroids as well, which we can give in the hospital setting.
Do these medications come with some side effects?
Yes, so important side effects to mention with antithyroid medications are that it actually can affect the white cells in the body, which fights against any infections. So it's a very rare side effect, but it can happen in patients who are on, especially on the higher doses of that. So there are certain precautions which are advised. The other side effect is that it could be it could cause rash in the body, some abdominal pain, some vomiting. It can affect the liver function test as well.
Okay. If the thyroid gland is overgrown and is quite prominent, do you go for a surgery option, or is it always treated with medication?
So in patients who have got large thyroid gland, we call it goiters. Surgical option is the best treatment for it, but of course it comes with some complications, and some patients are a bit reluctant to have surgeries. Then we have got another option called radioiodine treatment, which can lead to some shrinkage of the gland, but it doesn't actually cure it completely. But it certainly does control the hyperthyroidism.
Okay. We talked about goiter. Would you say a few words on goiter, like how does it look like prominently, so someone could spot on someone's body?
Yes, so it's most of the times it's quite visible. If it's a little bit enlargement of the gland, then it may not be visible. But if it's quite big, then it mainly would be looked as like a fullness in the front of the neck. And mainly it is noticed by people around them. The other thing would be that in patients with hyperthyroidism, not only it would get bigger in size, but also will be quite a bit painful as well. And patients can complain of painful swallowing and having like sore throat symptoms.
And it's right in front of the neck. It's quite lumpy. It can be easily spotted. My final question is, what is your advice for anybody who is suffering from hypo or hyperthyroidism?
So the most important advice regarding hypothyroidism is the advice which is around taking thyroxine tablets. Thyroxine is a tablet which is quite sensitive in a way that it has to be taken first thing in the morning on empty stomach, at least 30 to 45 minutes before a person takes their regular medications or their breakfast. Otherwise, it will not be absorbed from the digestive system, and that would lead to some very unreliable blood test results. And we have talked about pregnancy as well. So anyone who is on levothyroxine and they become pregnant, then they should immediately inform the GP so that, or their endocrinologist, so that the dose can be increased effectively. In terms of hyperthyroidism, we always give advice to the patients about the side effects of carbimazole, that if they have sore throat, mouth ulcers, or unexplained temperature, then they should immediately stop taking the tablet and inform their GP to do the full blood count and to check for the white cells. If these are in good range, then they should restart taking the tablet. A general advice about both conditions is to not miss the medications, because it can actually lead to quite severe problems.
Many thanks for your time, Dr. Khan. I believe the information provided our viewers will find very useful.
Thank you so much. It's a pleasure. Thank you.
Many thanks for watching this episode. If you find it useful, please share with your family and friends. If you haven't already, please make sure to subscribe to this channel. Thanks for watching.